Welcome to our UC Davis Department of Surgery Succeed program, faculty development didactic series. Today we're going to talk about professional development in regards to membership in our societies, society membership, and how does that affect your leadership journey and your professional development journey. I'm here with Dr. Misty Humphries, who is the program director for our Division of Vascular Surgery residency program, as well as an expert researcher in health sciences research. And we're going to have a little conversation about society membership and professional development.
I think the thing that I've struggled with as a junior faculty is knowing which organizations I should start with, and then how to be successful moving through the years in some of the larger organizations. So as a junior faculty member, what would you tell me to do in terms of the first organizations I want to make my name in?
Yeah, it's a very good question. One of my mentors once told me that you should be very involved in regards to your time and energy in two organizations, right? And you pick whatever two those organizations are, and that will involve a lot of your time or some of your time. And other organizations you can be involved with, but at perhaps a peripheral level. If you're involved with 3, 4, 5 organizations with a lot of your time and energy, then you're spread thin, you're taken away from your clinical duties and your responsibilities at your host institution. The second is I would look at membership in a strategic way. For instance, if you have a research theme, what committees within those organizations meet your research theme? So, for instance, if you're interested in patient-centered outcomes work, are there committees within those organizations that focus on that? If you're interested in quality improvement, are there quality improvement committees that within those organizations that fit that as well? The second thing is you always have to look at academic promotion and what activities outside of your institution take your time. I would suggest looking at those committee volunteer work and determine if there's any scholarly products that could be generated from participation in those committees.
That would be interesting. So using that committee to write up a guideline or something that could then potentially help get promotion.
Exactly. There's a lot of committees that work on guidelines, opinion pieces, position papers from experts. And many of those guidelines and pieces also evolve into other evidence-based work, whether it's surveys or multi-institution collaborations.
Now, you're very involved in the American College of Surgeons, and that's an organization as a specialty provider I struggle to find my way in.
Yes.
So I was wondering if you can tell me how you got involved in the American College of Surgeons and what you would recommend for the most junior faculty and as you move through your career, how to navigate that organization.
So I think coming from the perspective of a specialty surgeon, it's a very good question. The organization, the American College of Surgeons, which I'm very active in, is a big tent organization. We like to call ourselves the House of Surgery. And within that are all different types of surgical subspecialists, including ophthalmology and obstetrics, gynecology, and neurosurgery, and orthopedic surgery, subspecialties you wouldn't necessarily associate with a broad surgical organization. Now, I got involved with the college. Oftentimes, the American College of Surgeons is referred to as the college, as a resident. I was first involved as a general surgery resident, as part of their resident and associate society, and but just a little bit involvement. My residency program paid for my dues, which were nominal. But as a cardiothoracic fellow, one of my mentors, Dr. Mark Oringer, was extremely involved with the college. And he reached out to me and said, I really want you to participate in college activities and see what you can do from a cardiothoracic surgical perspective. So with that, I joined the Resident and Associate Society. So those are residents, medical students to some degree, and also graduates of training programs who are done with their training but have not yet transitioned to fellow at the American College of Surgeons. And with that, I just worked my way up from communications committees and other committees as a resident active member of the college. But all the while putting eyes on things that I could do from a scholarly standpoint. So I did tackle different topics such as simulation, transitions to practice such as coding and billing, and took that work and published in the Bulletin of the American College of Surgeons as a trainee. So that was a good opportunity for that. Then as I transitioned to fellow, as I graduated, I joined a subgroup of the college called the Young Fellows Association. And that's an excellent group for young surgeons. I think they define young surgeons as age 45 to 46 or less. And that involves many opportunities for leadership, working within the clinical congress and moderating sessions, creating sessions for the clinical congress, creating content. And they're always in need of specialists, whether it's vascular surgeons, cardiothoracic surgeons, or other specialists to help them develop content. And the YFA really served as a leadership incubator for me. It helped me understand sort of the Byzantine structure of the college, and it provided me with opportunities for leadership at different levels, including our local chapter level, the Northern California chapter at American College of Surgeons, and other opportunities to develop leadership.
Do you feel that there is a role for specialists within the American College of Surgeons, even in the small regional societies, such as the Northern California or the chapter society meetings?
Yes. So the college has a rich network of what are called local chapters. Now, each of those, interesting enough, each of those local chapters are amongst themselves a nonprofit, but they are part of the American College of Surgeons structure. And those local chapters are advantaged because they know what's needed at a local level. There's a lot of advocacy work, medical education work, and other activities that are germane to the surgeon who may not be looking at things on a national perspective, but at least looking at what's going on in their own backyard. With the NorCal chapter of the American College of Surgeons, we have partnered with two other chapters in California, the Southern California chapter and the San Diego chapter, to develop a California chapter's joint advocacy committee. And within this committee, we are looking at the advocacy needs within California, which are very complex, for all our chapter members. And that includes subspecialists and other individuals who are tied in with surgery, such as nephrologists in a recent proposition to look at dialysis clinics. Once you would say, what is that involving the college? Well, we have transplant surgeons within our specialty, and our transplant surgeons work closely with our nephrologists to provide services for our California patients. And so we felt there was a need to advocate on their behalf. So this year, I'm the president of the NorCal chapter of the American College of Surgeons, and I'm probably the first cardiothoracic president since Dr. Harkin from UCSF East Bay, probably about 10 or so years ago. But despite me being a subspecialist, it's the house of surgery and allows myself to become active and help influence the needs of our community.
In terms of a regional level, a lot of us are trying to get recognition at the regional level. And in California, what would you say would be the best regional societies for young faculty to be a part of?
Sure. So every surgical specialty has what I called their directional societies. So whether it's Western, Southern, Eastern organizations, whether it's, for instance, in cardiothoracic surgery, we have the Western Thoracic Surgical Association. And that association is really focused on Western states. And to be eligible, you either have to practice one of the Western states or receive your training in a training program in one of the Western states. And those programs those societies are often very educational. So they focus on an annual meeting in one of those regional states, oftentimes in a resort area, but really focused on what's new in the specialty, how are we educating our trainees, and where can we go forward in the specialty. So those are very easy societies to get involved with to look at what your regional level is. But I wouldn't necessarily look past the big national societies, such as the Society of Vascular Surgeons or the Society of Thoracic Surgeons, because those societies are really geared up to be advocates and work at the DC level for their members. And the onus is upon us to educate the larger societies in regards to the needs of our regional state level. This is what's going on in California. These are what Californians think, and these are our representatives in Congress from California. How can you help me engage them to think about the important needs of our specialty and our patients? So the organizations are really good to help with that. There are other aspects of the organizations that are very helpful. For instance, there's research seed money, especially for junior faculty and young faculty. And as you know, being an accomplished researcher in the surgical sciences, funding on a federal level is harder and harder to come by, especially for surgeons who are challenged by time constraints and the acute needs of our patients.
That's actually a very good point. We have a young vascular society that has multiple small grants that it gives out each year. I was just at this meeting last week, and they give out a young faculty award, they give out a resident award, but they also give out a faculty travel award. And this year we had only one application for that travel award. And they decided not to give out the award because there just wasn't a good enough competition, and the application wasn't as advanced as they would have liked. And I think that a lot of times the faculty forget that there are these smaller awards that they could apply for, and they're very helpful.
Yes.
It may be $5,000, but that $5,000 can allow you to travel to various places, to interact with women's leadership, to interact with clinical programs that you're interested in, or even building at your own institution. I think we do frequently forget that some of these smaller awards are something that are very helpful for us.
Yes, and it helps you to fund that data that provides preliminary data that then can be transitioned and translated to a larger grant. And what I advise faculty and trainees as well who are thinking of taking a year or two off to do research during their training program, and even medical students, is really go online and look at the different societies, surgical societies, that are somehow related to the research that you're doing, and look at the research opportunities and the funding opportunities that are there. I think each society does its best to disseminate that information, but at the end of the day, it's difficult to reach every single potential audience member that might benefit from that work. These organizations are some of them are sizable, but they're not NBC, CBS, or ABC. So their ability to reach all audiences can be limited. So in many ways, it's the onus of the audience to go online and look at these different societies and see what they have to offer. And there's a lot of good stuff to offer.
I think the political advocacy area is also an area that is really changing right now. I think a lot of us want to see advocacy in certain areas. How do you see young faculty getting involved politically through societies?
Yes. So generally there are many opportunities for young faculty to get involved. And that varies to developing their own positions and advocating for that. There are many ways within sort of the non-specialty societies, patient advocacy societies such as the American Lung Association or the American Cancer Society to do that. But one thing that the surgical societies offer, one is professional development in advocacy. So there are many scholarships that allow young faculty or even faculty in general to go and learn how to be advocates, learn about public policy, learn about the separations of power and federal, executive, congressional, et cetera, to learn those things that we thought we learned in junior high school, but we forgot. How does a bill become a law? How do you interact with your congressperson? And what type of conversations that they have. One example is at the most recent Society of Thoracic Surgeons meeting that we had in San Diego, their political action committee, their PAC, held a very good informational didactic. And one of our cardiothoracic residents, Dr. Amir Sarkisic, is a resident participant in the STS PAC. And he and a faculty member at Stanford, Dr. Natalie Louis, held a mock congressional meeting where they did role play and demonstrated a good congressional meeting where you as the advocate come prepared, you know what you're talking about, you have an elevator speech, and you're able to provide information and you're respectful for that congressional staffer's time, as well as a mock congressional person meeting that did not go well. You know, they were not prepared. They didn't know acronyms. They spoke in acronyms, and they spoke at a level assuming the congressional staffer has medical experience and complex understanding of nomenclature. And that was a well-attended session, and it was very informative for everyone involved. And most surgical programs, surgical groups have a day at the Capitol, whether it's a day at our national capital or a day at our state capital. For instance, the Northern California Chapter American College of Surgeons will be partnering with the California Medical Association for an advocacy day in our state's capital in California in April. And that will be an exciting time to learn about the process and then meet with our state legislatures to talk about the important needs of our surgical stakeholders as well as our patients.
Wow, that sounds really interesting.
So really a lot of exciting stuff. I always say this is a big alphabet soup, right? And each alphabet represents an important aspect of surgery. And the professional societies are a wonderful way for faculty to get involved, disseminate their research, learn about what's going on out there, and attain funding to promote their research, and really become part of the national and regional fabric of the surgical specialties.
You mentioned how it can also help you in promotion.
Yes.
So I'd like for you to expand on that a little bit more, not just publishing our research there, but participating in committees and how that all plays into our promotion here.
Sure. So in most centers, most academic centers, there are specific criteria for promotion from assistant professor to associate professor and associate professor to full professor. Oftentimes, and this varies per institution, and I would advise any person to look over their merit advancement and promotions process. But to go from assistant to associate professor, you need to have a national reputation, right? That doesn't mean that when you land in Des Moines, Iowa, everyone genuflexes at your arrival, right? But it just means that someone within your specialty says, yes, I've heard of Dr. Humphries. I've seen some of her work and published. Yes, that her work rings a bell. And how do you get that recognition? And oftentimes publishing and being successful in your work, but also meeting people who are outside of your regional sphere and meeting people who are in different parts of the country and are experts in their field as well. And the society structure, professional society structure, is well positioned to help you do that by being active in committees. Second, at least in our institution, in order to be promoted from assistant to associate, you need what are called arm-length referee letters of support for your promotion. And arm's length means that you haven't necessarily published with those individuals, and they're not individuals who have trained you, but they are individuals within your sphere of specialty who have an understanding of who you are, right? And being active in committees within professional societies is a wonderful way for those potential letter writers to get to know you and understand what you're capable of and what you're doing and all the exciting things you're involved with. And it's just a very easy way to get letters of support in that fashion.
Wow, I think that'd be a very helpful way. Knowing people that you've worked with on committees would be the best people probably to speak on your behalf.
Correct.
So they don't, the arm's length doesn't have to be someone that doesn't know you, it can even be somebody that you're friendly with on your committee that you know too. It doesn't have to be somebody that completely is unaware of you, just reviewing your CV.
Exactly. Because one of the wonderful things about our specialties is that they're relatively small, right? So to find someone who doesn't know you can be a challenge.
Yeah.
And so most people know you, but generally arm's length for people that you're not consistently publishing with, and in theory didn't necessarily train you during your fellowship and residency programs.
No, nice.
Well, great. So I think this has been a wonderful conversation. I hope this has been very helpful, and I think it will be extremely helpful to our audience. And again, this is part of a didactic series for professional development, part of our UC Davis Succeed program, ensuring surgeon success. Thank you.
Thank you.